Drugs used to decrease the craving for alcohol. There's 3 drugs which fall into the category of drugs used to treat alcohol use disorder. What are they? Acomprosate is an old drug. It's given 333 milligram tablets 3 times a day. It's supposed to block the cravings. It does something with GABA and glutamate. Doesn't work that well. I've tried using it, so that one, maybe it works, maybe it doesn't. There's Naltrexone, which is an opiate-based. It blocks the mu-opiate receptor. It's supposed to decrease the pleasure you get from alcohol. It has some effect. I found it to be somewhat useful. 50 milligrams a day. They have an injection, which is really expensive, which is not worth it. Most of these drugs, if people don't get any benefit, they're like, what am I taking this for? But there's some decrease in craving, I would say, with the Naltrexone. It's a generic pill. It's cheap, 50 milligrams a day. Don't be getting that injection, Rivi. It's ridiculously priced. There's no benefit to that. The next one is disulfiram, Antabuse. All that one does is disrupt the enzymes which are involved in the breakdown of alcohol from alcohol to aldehyde to acetate. So you get a buildup of aldehyde. It blocks aldehyde dehydrogenase. And so what happens, if you take that and you drink, it's like a negative conditioning. It causes sweating, flushing, red face, nausea. You feel horrible, anxious, blood pressure goes up. But so if you're an alcoholic, why would you take that if you want to drink? You'll just stop the Antabuse and start drinking. There's other drugs. There's one called Topomax Topiramate, which is an anti-seizure, modulates glutamate and GABA. It's not clear how exactly that one works, but that can simmer down your cravings. That one works pretty well. 25 milligrams twice a day, up to 100 milligrams twice a day. It's also used for seizures, migraine prevention. Topiramate works pretty well. Problems, I've had people taking it get mental fog, cognitive slowing. It makes you eat less. There are also some dizziness side effects, possible kidney stones. It's all right. I've used the drug. It's a good drug, but the mental slowness is a problem. Then there's Neurontin Gabapentin. Yeah, it decreases anxiety, has a calming effect. I mean, I've seen people take doses from 100 milligrams 3 times a day to 800 3 times a day. It's well tolerated, maybe cause a little edema in your feet. So Neurontin can be used to block the cravings, gabapentin. There's some other ones. What would the next one be? Baclofen. Baclofen is a muscle relaxant. It modulates the GABA B receptor. That one, taken 5 milligrams 3 to 4 times a day to 10 milligrams or even 20 milligrams 4 times a day, has a calming effect. People like taking it. It seems to take the edge off. They like that better. The other ones block the craving. The Acomprosate, the Naltrexone, those block the craving. Antabuse, disulfiram, sort of gives you a reaction when you drink. That really doesn't work. Topamax has a calming effect, topiramate. People like taking it. They really like taking Baclofen. It takes the edge off. And it blocks their craving. That one, I would say, has the most impact. Neurontin also takes the edge off. The next one would be Clonidine, which is an alpha-2 receptor agonist. And that one blocks the body's adrenergic system, the flight or flight system. So modulates GABA, modulates glutamate, glutamic acid, so you're less anxious, less distressed. So it has benefits. Vacine, given at night, 1 to 3 milligrams. That takes the edge off. It blocks the flight or flight, which has activated the adrenergic system in withdrawal or not drinking. So other things that of honorable mention, I've used trazodone, 25 milligrams 4 times a day. That takes the edge off, blocks the craving. Mirtazepine at night helps people sleep, takes the edge off, decreases anxiety. It's an antidepressant. Trazodone is used for sleep and an antidepressant. but it can really take the edge off. Another one is quetiapine, Seroquel, 25 3 times a day, or take just one dose at night, 100, 200 milligrams, depending on the individual, sometimes 25, 50. So what I wind up doing, those are the drugs I work with when I'm dealing with people trying to block the cravings, the restlessness, post-acute withdrawal, desires, thoughts of alcohol, all the accompanying signs and symptoms of missing the alcohol, psychological, physiological. I have to stack polypharmacy. So what I do is, they say, I feel restless during the day. I may add a trazodone, a quetiapine during the day. I may add a Neurontin, Clonidine during the day. They say, I can't sleep, I'm restless all night. I may use quetiapine or trazodone or Remeron at night. So I have to use polypharmacy with one of these drugs, or stacking, and it's usually 3 to 4 drugs. I hate to say it, but people's drive to drink is very powerful. My experience is, what's going on, there's the psychological, like, I just want to check out, I want to get high. And there's also, it's 2 components, the psychological component of I want to drink, but then there's the physiological. Once your body's used to alcohol, your body just tells you to drink. The best experiment for people out there is, you're like, my body, that's ridiculous. Well, your thoughts are half yours, half your body's. And if you think not, close your eyes and say, I'm not going to think of anything. And thoughts will come to your conscious mind. And you know what that is? Your body talking to you. Go eat a piece of chocolate cake. Go talk to so-and-so. Go do this, go do that. Let's have lunch. I feel like having a drink. So it's real. So other things you can do is wait 20 minutes and the craving will be gone. Heavy physical activity, sunlight, lots of it. Homeopathic things, which can be used to block the cravings. I've seen ashwagandha used. I've seen kudzu used. I've seen L-theanine used. I've seen magnesium L-threonate used, 2,000 milligrams. Valerian root, chamomile tea, they help. So it's like building a pyramid. You've got a stack, and no one thing I'm saying here. You're going to have to use a multi-dimensional path or pharmacopoeia to treat cravings, because it's so intense. Obviously, therapy helps. The support of the 12-step fellowship, an AA program, can help with cravings. Talking to a loved one can help. So these are the strategies I use. A key here is avoid things which remind you of drinking, like bars, restaurants, holidays. Just pretend 4th of July and New Year's Eve don't exist, because those are the worst. Funerals are not good. Weddings are not good. First dates. These are where I see people drink. But it's tough. And all these are kind of strategies you use. And guess what? Not all of them have to. You must use what works and experiment with all different avenues together is what I do. So there's no one thing I use. I use multiple drugs, multiple psychological strategies, behavioral strategies, group strategies, family therapy strategies. You use everything you can, because the drive to drink is like a drive for survival. In the mind of an alcoholic, if they don't have that drink, they'll die. It is that powerful of a drive. Dealing with that is why it's so complex. And when I deal with people with alcohol cravings, I wrote a book on it, A Chance to Change. It's for sale on Amazon.com. So check it out. Mark Agresti. Hey, I appreciate comments, likes, and subscribing to my channel. Thank you. Bye.